Welcome everyone to this comprehensive review on foundations of nursing. Today we will not only revisit crucial concepts in pain management, integrative medicine, and perioperative nursing, but also take an in-depth exploration of various sleep disorders. Let's commence our detailed examination by revisiting the multifaceted nature of pain. Categories of pain: duration, acute pain, swift onset ranging from mild to severe, serving a protective role and resolving once the underlying cause is addressed. Chronic pain, emerging 3 to 6 months post-normal healing, persistent or recurrent, often poorly localized. Localization, location, cutaneous, involving the skin or subcutaneous tissue, somatic, scattered across tendons, ligaments, and bones, visceral, poorly localized within body organs, referred pain where the sensation is located in one area but experienced in another. Pain management, analgesic drugs, pharmaceutical agents designed to alleviate pain. Non-opioid analgesics, examples include acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs. Opioid analgesics, controlled substances such as morphine, oxycodone, meperidine, hydromorphone, and methadone. Adjuvant analgesics. These include anticonvulsants and antidepressants, serving to enhance the overall pain management strategy. Opioids. These substances attach to opioid receptors in the brain, modulating pain perception. The binding also occurs with immune system cells, potentially impacting immune function. The main receptors include mu receptors, which are associated with respiratory changes, euphoria, pupil and gastrointestinal alterations. Side effects encompass sedation and nausea, with a significant adverse effect being respiratory depression. Prolonged use may lead to tolerance, physical dependence, and addiction. Non-opioid analgesics, acetaminophen, recognized as the safest and best tolerated option. However, hepatotoxicity is a concern, particularly when exceeding 4 grams per day or with prolonged use. NSAIDs not only possess analgesic properties but also exhibit anti-inflammatory effects. However, caution is warranted in individuals with bleeding disorders. Adjuvant analgesics, originally approved for conditions other than pain management, serve to mitigate anxiety associated with pain and alleviate side effects of opioid use. Examples include antidepressants, anticonvulsants like gabapentin, lidocaine, corticosteroids, and NMDA agonists. General principles in using analgesics. Initial pain assessment is crucial to tailor the approach. Commence with non-opioid interventions before progressing to opioids. Time administration to align with the peak analgesic effect. Continuous pain control is paramount for acute pain management. Consider patient history and preferences, encouraging open communication about effectiveness. Pain and integrative medicine. Integrative health combines complementary and conventional approaches to health. Integrative medicine places emphasis on the relationship between patient and practitioner, addressing the entirety of the individual and leveraging evidence-based practices. Highlight the role of the Integrative Health Institute at UMB in managing pain and stress without relying solely on opioids. Allopathic medicine versus holism. Allopathic medicine views illness in mind and body as separate entities, defines health as the absence of disease, and emphasizes high-tech interventions. Holism, on the other hand, centers on the interconnectedness of all parts within the whole, considering individuals as unified, dynamic entities engaged in constant interaction with their environment. Psychological aspects of pain. Delve into hypersensitivity to pain, catastrophizing, central sensitivity, kinesiophobia, fear of pain, and stress, elucidating how these psychological factors influence the pain experience. Discuss the impact of psychological aspects on pain expression and disability, emphasizing the interconnectedness of mental and physical well-being. Integrative approaches. Guided imagery, evoking pleasant mental images to replace stressful ones, often beginning with relaxation. It's readily available through videos, scripts, and apps, requiring a quiet and comfortable setting. Aromatherapy uses essential plant oils to promote relaxation or address specific conditions, such as lavender for relaxation, ginger for nausea, and chamomile for insomnia. Music and sound therapy utilizes music for relaxation and communication, along with calming sounds like a sound bowl. Acupuncture involves the insertion of small needles into meridians to balance the body's vital energy, qi, commonly used for pain and stress reduction. discuss how these integrative approaches can enhance traditional pain management, providing patients with additional tools for coping. Perioperative nursing. Types of surgeries. Categorize as elective, pre-planned, minor or major degree of risk, urgent, must be done reasonably soon to preserve health, and emergency, immediate to preserve life, body part, and/or function. Informed consent. Detail the essential components, emphasizing that the patient must voluntarily agree and the provider must provide comprehensive information. Postoperative complications risk factors. Consider developmental and medical surgical history, medication history, nutritional status, and activities of daily living. Discuss how these factors may impact postoperative recovery, highlighting the increased risk for infants and older adults. Emphasize the role of the perioperative nurse in monitoring and addressing these factors to optimize patient outcomes. Safety. Fire safety. Unpack common causes of hospital fires, discuss the nurse's responsibility in ensuring a safe environment, and introduce the RACE priorities for dealing with a fire. Stress the importance of nurse training in fire safety protocols and the need for constant vigilance in healthcare settings. Sleep. Examine sleep cycle changes with age, emphasizing the importance of adequate sleep duration for different age groups. Discuss the stages of NREM sleep and REM sleep, along with factors influencing sleep. Provide detailed sleep requirements by age groups. Infants, 16-24 hours. Toddlers, 11-14 hours. Children, 10-12 hours. Teenagers, 8-10 hours. And adults, 7-9 hours. Highlight the consequences of inadequate sleep, emphasizing its relationship to various health conditions. Sleep disorders. Now let's delve into a more comprehensive understanding of various sleep disorders. Insomnia. Difficulty falling asleep, maintaining sleep, or intermittent sleep. Prevalent in 30% of adults, more common in individuals over 60, women, postmenopause, and those with a history of depression. Causes include disruption in circadian rhythms, periods of stress, pain, discomfort, limited mobility, and medication side effects. Consequences encompass daytime tiredness, lethargy, irritability, difficulty concentrating, and delirium in healthcare settings. Treatment involves addressing underlying causes and may include cognitive therapy, relaxation training, and pharmacologic interventions. Obstructive sleep apnea, OSA, involves the relaxation of throat muscles, leading to the blocking of the airway and interrupted breathing during sleep. Consequences include sleepiness, fatigue, and snoring, with potential health issues such as cardiac disease, diabetes, cognitive function decline, and mood disorders. Treatment options include continuous positive pressure breathing machines, CPAP, or mandibular advancement devices. Highlight the importance of early diagnosis and intervention to prevent long-term complications. Idiopathic hypersomnia. Common in teens and young adults, individuals may fall asleep during the day while engaged in various activities, exhibiting irritability, disorientation, restlessness, and slow thinking when awake. Treatment typically involves stimulants and occasionally antidepressants. Emphasize the challenges individuals with idiopathic hypersomnia face in daily functioning. Narcolepsy, characterized by excessive daytime sleepiness and sudden lapses into sleep. Individuals with narcolepsy can fall asleep at any time, even during activities like driving or standing. Treatment often involves multiple stimulants, and the condition tends to be lifelong. Discuss the impact of narcolepsy on daily life and the importance of ongoing management. Parasomnias includes various sleep-related disorders such as somnambulism, sleepwalking, sleep behavior disorder, thrashing or moaning while asleep, sleep terror, screaming during deep sleep, nightmare disorder, disturbing dreams, sleep enuresis, bedwetting, sleep-related eating disorder, and restless leg syndrome, RLS. Treatment approaches vary depending on the specific disorder and may include lifestyle modifications, pharmacologic interventions, and behavioral therapies. Emphasize the importance of tailored interventions for each parasomnia. In conclusion, we've explored critical aspects of pain management, integrative medicine, perioperative nursing, and delved into the intricate world of sleep disorders. Understanding these topics is crucial for providing comprehensive patient care. I encourage you to thoroughly review these concepts and welcome any questions you may have.